It really is like someone poured gasoline on my legs and set them on fire.
I was never, ever prepared for what I saw.
Didn't even look like him. I could barely recognize his face.
I woke up and I was gasping for breath. And then I lost consciousness.
Why was this happening again?
Next, two medical mysteries that defy the experts. Walt Bridegan's seemingly ordinary life is turned completely upside down when he gains more than 100 pounds in less than 24 hours, forcing his family to face a terrifying reality.
I just never thought that somebody could hold that much weight. I kept saying to them, please don't let him die. Please don't let him die.
Then, when Mary Brown endures a series of mysterious lung collapses, she's forced to face a devastating reality that no doctor can explain.
There were hundreds of little cysts throughout both lungs.
It was quite difficult.
In the winter of 2005, 48-year-old Walt Bridegan was in the prime of his life. He had a good job working as an engineer, 3 grown children, and had recently celebrated his 26th wedding anniversary with his wife, Nancy.
We became very much in love at an early age.
I met Walt when I was in the 8th grade. We were absolutely meant to be together.
Nancy is the love of my life. I've loved her since I was 15, and even now, it's as strong as it was when we were 15.
Throughout their life, Walt stays nearly as active and fit as he was when they first met.
Walt was a very athletic guy, never sat still, always liked to coach, very seldom ever missed work.
I had never gone to the hospital and never had any medical conditions.
But in February of that year, the usually indestructible Walt wakes up one morning with what seems to be a case of the flu.
It was a tired feeling that you could not get out of bed.
It seemed like his symptoms were like an upper respiratory virus. My daughter had had the exact same symptoms a week before.
I thought, after a couple days, this will pass. I never liked to be off work, so I went into the office. About 2 hours after I arrived at work, I started getting like these little bursts of light through my vision. I was afraid I was going to pass out. So I had one of my coworkers call my wife immediately so she could pick me up.
He could barely make it to the car. I knew there was something wrong, so we rushed to the doctor's office.
The doctor said, let's check your blood pressure and see where it stands.
It was like 70/50. 120/80 is a normal blood pressure. The doctor said, wow, that's a really low blood pressure.
Low blood pressure is a condition in which diminished blood flow deprives organs throughout the body of oxygen and other nutrients. Extreme cases can be fatal.
This was really odd to me. I had never had anything but good blood pressure.
The doctor said that he felt that it was due to dehydration from the upper respiratory virus that he had.
The doctor gave me some medication that would raise the blood pressure. With nothing else to do, we just went home.
When we got home, I helped him up the stairs into bed, and he felt that if he could lay down and rest, he would be fine.
But about an hour later, Nancy is startled by a strange noise coming from upstairs.
I ran upstairs to the bathroom, and Walt is passed out on the floor. So I'm screaming his name, saying, Walt, Walt, wake up. In the meantime, I'm yelling for my son to call 911. I actually thought, and when I couldn't bring him to, that he had passed away. As As soon as the paramedics got there, and the first thing they did was check for a pulse, and they said to me, "Ma'am, we cannot find the pulse." Well, by this point, I'm like, oh my goodness, we're gonna lose him right here. And I kept saying to them, please don't let him die. Please don't let him die. You have to save him.
Seconds later, to Nancy's relief, Walt opens his eyes.
When I came to, and the paramedics were working on me, I thought, I'm in trouble. I've got some serious problems.
They got him stable enough that they could find a faint pulse and the blood pressure. They loaded him up into the ambulance.
When the ambulance pulled up to the hospital, all you can see is everything's happening so fast. And there's doctors, nurses around you.
They saw his blood pressure, and they said to me, he is extremely, extremely critical.
Because the pressure was so low, they were trying to pump as much IV saline solution as they could to try to regain blood pressure.
The IV transfers water directly into Walt's bloodstream, increasing the volume of fluid in his blood vessels, and as a result, the amount of pressure against the blood vessel walls.
The fluid was helping him, but I could not take my eyes off the blood pressure machine, and it still was not raising up the blood pressure as much as what I thought it should.
Unsure of what's causing his low blood pressure, the doctors begin running a battery of tests. But before they get back any results, a frightening new symptom sets in.
I started getting pain in my legs. It started gradually, then it started getting progressively worse. It really is like someone poured gasoline on my legs and set them on fire.
This absolutely came out of nowhere. I had never seen somebody in that much pain.
They had connected the morphine to the IV, and immediately the pain subsided. Now I was starting to worry about my condition and why I was there.
The doctors kept saying to me, we have no idea what is wrong with him. We'll wait for the blood work to come back.
2 hours later, the findings are in, and they're nothing short of shocking.
He said that you have low white blood cell count, and that the severe pain that you have in your leg, maybe you have the flesh-eating disease.
They said to me that they had one a couple months ago, and the symptoms were exactly the same.
Flesh-eating disease, or necrotizing fasciitis, is a fast-moving infection that corrodes the skin from the inside out and often results in death.
Most people do not survive this. I knew that most people, their organs shut down. I was extremely terrified.
How does this happen that you go from low blood pressure to something that's critical and life-threatening? This was really upsetting. It's really starting to worry me. Am I going to make it out of this hospital?
In the summer of 1993, 35-year-old Mary Brown was in the prime of her life. She and her husband John loved raising their 2 children in Southern California, and Mary had become a pro at juggling a very busy schedule.
I've worked for the Santa Barbara County Education Office as a speech and language pathologist and as a special education teacher. I loved my job and I loved my work with children.
Growing up, my mom was a powerhouse. She was charismatic, outgoing.
In her free time, Mary is just as energetic, working out several times a week.
I exercised 2-3 hours a day. I liked cycling. I liked step classes. We did a lot of hiking in those days.
We had to be in shape to do the hikes because a lot of times we'd be carrying, if it wasn't a pack, we'd be carrying the kids.
I never had any significant health problems at all.
That summer, Mary takes the children to celebrate the 4th of July at her mother's lakeside house in Michigan. On July 3rd, she goes to bed, looking forward to the next day's celebration. But she has no idea what is about to happen.
About 3 o'clock in the morning, I woke up and I was gasping for breath. And I was seeing little black spots across my vision. And I called out as loud as I could, "Mom, something's wrong." And then I lost consciousness. My mother called 911 right away. The ambulance arrived within minutes, and the EMT workers began CPR resuscitation.
I remember seeing my mom being brought out of the house on a stretcher. They had a respirator around her face, and I thought, oh my God, my mom is dead.
Just 4 hours ago, Walt Brightigan's blood pressure fell so low, paramedics could barely find a pulse. Now, doctors have an entirely new but equally pressing concern. Walt may have contracted a deadly flesh-eating disease.
Right before they took Walt up to do the testing, I said to him, Walt, I want you to give me a promise that no matter what, you will fight to the very end because I cannot live without you.
I gave her my promise I'd stay alive. I've never broke a promise to her, but I didn't think it was going to last many more days.
The wait for the test results is agonizing. But a little over an hour later, they get the answer they've been praying for.
And the doctor said to us, all the results came back negative. We do not believe that he has flesh-eating disease.
I think there were 12 doctors that were checking on me, and no one really had an idea why I was there.
The doctors at that point said, we're going to put him in ICU.
There, Dr. Gregory Fino, an intensive care specialist, is put in charge of Walt's unusual case.
The most concerning part of Walt's admission was that he had very low blood pressure. The first treatment is fluids, fluids, fluids. My problem was I did not understand why. His blood pressure was very low to start out with.
Throughout that night, the medical team continues to administer fluids in an effort to keep Walt's blood pressure up.
They came to me and said to me, you cannot stay in the hospital. He is too sick. And as I was walking out of the hospital, I kept thinking to myself, I cannot go home without him. What will I do?
But by the time Nancy and their daughter Lindsay arrived the next morning, Walt's developed a grotesque and terrifying new symptom, unlike anything the doctors have seen before.
Dr. Fino said, we need to prepare you for what you're going to see when you walk in. But I was never, ever prepared for what I saw. I could not believe it. His face when I went in, it didn't even look like he had any features. It just looked like this plain, blown-up balloon. I actually would have said that it was not my husband.
It didn't even look like him. I could barely even recognize his face.
When I saw the look on Nancy, and then I saw the look on Lindsay, I can tell that there's something wrong and grotesque. I begged her, Nancy, you have to let me look at my face.
So I grabbed the mirror out of my purse and I showed him.
When she raised the mirror and let me look, it's like looking at a picture. All you can see is the face of maybe a ghoul or a goblin. It was a faceless person. Even though I gave her my promise I'd stay alive, and I love her so much, I just didn't think I'd keep that promise.
Walt had one of the most dramatic water weight gains that I have ever seen in my life. Within 24 hours, he gained about 100 pounds.
While doctors are baffled by the transformation, one thing is clear. If something isn't done soon, Walt's skin could literally burst.
Dr. Fino explained to me that if I didn't start going down in size, that the skin wouldn't be able to take it, and they would have to cut me to relieve the pressure.
So what you have to do is called a fasciotomy, and that's just a medical term for making an incision from the back of the knee down to the ankle and just filleting, like you would fillet a fish open, to let all the excess pressure out so the blood could flow.
I just begged him not to cut me.
There is one other option on the table. Administer a diuretic medication, a drug that will force Walt's body to begin eliminating fluid naturally.
To get rid of fluid, they stimulate the kidney, and you're taking more fluid out and you're passing it in your urine. But I was very, very concerned that if I give diuretics, it could drop his blood pressure again. I was between the proverbial rock and a hard place, but I decided to give him diuretics.
I did not know for sure if I was going to make it through this.
The waiting was almost unbearable.
But after a few hours, the diuretics begin to drain the excess fluid from Walt's body without drastically lowering his blood pressure.
Dr. Fino said the swelling has stopped, so we're not going to have to cut him. And I thought, oh, that's fantastic.
And over the next several days, Walt's blood pressure finally stabilizes.
It was my belief that at that time he may have had a viral illness like a cold that just caused an inflammation in his blood vessels and swelling and resulted in the low blood pressure and all of his problems. But really felt that this was a self-limited condition.
Dr. Fino said to me, I'm 99.9% sure it will never happen again.
Relieved and shaken, Walt and Nancy head home, eager to put the whole nightmarish episode behind them.
He was just like the old husband that I had back before. We just counted our blessings and moved forward. For the next 2 years, we were a totally happy family. We never really even talked about it anymore.
But the Bridigans' problems are far from over. A little over 2 years after the attack that nearly killed him, Walt wakes up one morning feeling sweaty and exhausted.
I'd gotten the flu, which I never thought anything about it because Nancy had gotten the same flu.
But later that same day, Nancy hears a terrifyingly familiar noise coming from the upstairs bathroom.
I go rushing into the bathroom and he was passed out on the floor. And I'm thinking, no, this can't be happening. Please do not let this happen to him again.
I said, Nance, it's back. It's the same thing. I know it. You gotta get me to the hospital now.
I really didn't think that we would be able to survive this time around.
I really thought I'm gonna pass away.
35-year-old Mary Brown has always been in perfect health. But during a visit to her mother's, she wakes up in the middle of the night, unable to breathe, and then suddenly collapses, completely unconscious. Now she's in an ambulance, racing to the closest ER.
The first thing that happened at the hospital was that the emergency room doctor listened to my chest and immediately took an x-ray and confirmed what he'd suspected, that I had a collapsed lung. And they told me it was an 80% lung collapse.
A collapsed lung, or pneumothorax, is a condition in which air escapes from a hole in the lung and builds up in the chest cavity. Eventually, the air presses on the lung until it collapses. Left untreated, the condition can be fatal.
The air that was trapped in my chest cavity was starting to impinge on the function of my heart.
With her heart slowly shutting down, the medical team rushes to insert a tube into Mary's chest to pump out the trapped air.
As soon as they started pumping the air out of my chest, I felt better. I immediately started coughing and inhaled very, very deeply.
They described it like a balloon deflating, and that they blew it back up so that it was okay now.
The doctor said that it was a spontaneous pneumothorax and that I shouldn't worry about it because it would probably never happen again. And at the end of 5 days, I was discharged.
I was ecstatic when she was able to leave the hospital, and we were so happy that she was over this traumatic situation and we're together again.
But over the next 3 years, Mary finds that she's increasingly winded when she exercises. And one day in the spring of 1996, while forcing herself to jog, her difficulties come to a head.
I could not go on, and I sat on the ground. I felt panicky, first of all, because I couldn't breathe. I took big gulps of air. I tried to not panic. I had never experienced anything like that before. I went to see a pulmonologist, and he gave me a lot of breathing tests, and I performed at about 80% of normal. And it took a lot of effort even to get just 80. And he believed at that point that I was probably suffering from exercise-induced asthma.
Exercise-induced asthma is a condition in which heavy breathing during vigorous exercise irritates the lungs' airways, causing them to contract or narrow.
The doctor prescribed an inhalant that I should take before exercising, and that would keep my breathing up.
The inhaler helps, But as time goes by, Mary is able to do less and less.
Over the years, the shortness of breath did get worse. I was very frustrated that I was not getting better.
My mom had a lot of trouble going on the hike she used to do very easily.
I had to stop frequently to catch my breath.
But any hope Mary has that her condition will improve comes to a shocking end in August of 2000.
We were preparing for a family vacation, so I was packing up the van. In order to fit more in the van, I decided to take out one of the chairs. When I lifted the chair, I realized that I shouldn't have done it right away because I felt the pain in my shoulder, I felt shortness of breath. And I also had this odd feeling of bubbles going up my back. I realized I must have another lung collapse, and it was on the right side.
We rushed to the ER. Because it happened on this other side, it was a great concern. It was a mystery. Why was this happening again?
We went right in to see the doctor, and as soon as he listened to my breathing sounds, he said, "I believe you have another lung collapse." I was pretty upset.
Once again, doctors hook her up to a chest tube and reinflate her lung.
And that was a tough time. I was so frustrated. We were told that she couldn't have another lung collapse.
And once she's stable, her doctor performs a CT scan to examine the lung more closely. And the results are completely shocking.
There were probably hundreds of little cysts throughout both lungs.
A cyst is a thin-walled bubble filled with air or fluid. It can appear anywhere, has multiple causes, and is usually benign.
And some of them were as big as a nickel or a quarter, and many were like the size of the top of a straw. The doctor explained that the number that I had and the size of some of them was not typical. It was a little sickening to look at, actually.
But when doctors perform a biopsy, they're even more perplexed by what they find.
The pathology reports came back negative.
I was glad that it was nothing obvious, but I was worried that it had to be something. But it was very scary knowing that they didn't know what was causing the cysts.
Baffled, Mary's medical team can't do anything but release her with instructions to continue using her inhaler.
They didn't change my diagnosis of exercise-induced asthma, and I understood that I was getting all the treatments that were available for what they knew at that point. But I got concerned and worried, not having answers.
She was very frustrated. Mary got frustrated enough to try to find answers and to get another opinion.
My pulmonologist suggested that I go to this special hospital. Maybe they had some answers for me.
Mary immediately schedules an appointment and begins counting down the days.
A month later, my husband and I flew to Denver for an appointment at the National Jewish Hospital.
But halfway through the flight, she notices a frighteningly familiar pain in her left shoulder.
I could tell that there were some clicking sounds, some pain, just some odd things happening to my left lung. And I turned to my husband and said, "I think I have another lung collapse."
Nancy Bridigan has just discovered her husband Walt unconscious on the bathroom floor. It's a horrifying replay of the episode from 2 years earlier that nearly ended his life.
I kept thinking, I know we're not going to make it through this one. He's not going to be strong enough. My mind started racing. How could he have another attack of this? So I called 911. The paramedics come. He said his blood pressure is so low. And I said, I know. This happened before. They hooked him up to the IV again and took him to the emergency room.
There's a lot of people around. The doctors are starting to run to assist you. It's a really bad feeling.
Alarmed at Walt's vanishingly low blood pressure readings, ER doctors once again pump him with fluids in an effort to raise it.
I was really starting to swell up.
And in my mind, I kept thinking, are we going to blow up like that again?
By chance, the specialist who spearheaded his case during the last attack Dr. Gregory Fino, is on duty at the hospital when he hears that Walt is back.
I was in the intensive care unit when he came to the hospital. I thought, here's an instant replay of 2 years ago. This could not have been a virus the second time around. I've got to dig further because something else is going on. And I've found a syndrome that was described in 1960. It was a case report of a very, very rare disease, and he fit the picture perfectly.
Dr. Fino came in and he had this article in his hand and he said, "Walt, I think I know what's wrong with you."
They told Walt and Nancy, based on the swelling and the recurrence, his diagnosis best fits with the condition called systemic capillary leak syndrome.
Systemic capillary leak syndrome is an extremely rare disorder in which capillary walls actually leak fluid. In healthy individuals, capillaries transport blood and water throughout the body. But in patients like Walt, the capillaries suddenly develop holes, causing water to leak out and blood pressure to plummet.
The capillary is the very smallest blood vessel that carries blood and water so the tissues can get their nutrients. So they're like very small garden hoses. His garden hoses, or capillaries, had little holes in the side of them, and stuff leaked out.
I said, well, this is great. You know, after all these years, I now know what I got.
Unfortunately, Dr. Fino can't explain why Walt suddenly developed the disease after so many years of good health.
Systemic capillary leak syndrome is a mystery as to what causes it. We doctors just don't know. It's just one of those odd diseases for which I have no explanation why he went from 2005 until 2007 without symptoms.
But it's clear that when Walt passed out 2 years earlier, the disease had just set in.
You have leakage of water out of the bloodstream, and your blood pressure drops. And when you get very, very low blood pressure, the brain doesn't get enough blood and oxygen, and you faint.
As the water continued to leak out of Walt's capillaries, it began to build up in his surrounding tissue, ultimately triggering the severe leg pain that doctors mistook for a flesh-eating disease.
He had all of this fluid outside of his blood vessels in his legs. The major nerve in his leg got compressed, and blood vessels got compressed, so the muscles weren't getting enough oxygen.
Ironically, the more fluids doctors administered to stabilize Walt's blood pressure, the more water leaked out of his capillaries, causing the grotesque swelling.
If you have a couple gallons of water in your blood system, 90% of that water leaked out of the blood system into his arms and legs. We also gave fluids intravenously, and he got more and more swollen.
With a diagnosis finally in hand, the question now is how to treat his disease before it kills him.
If he really lost even more fluid out of his blood, all of his organs may have just shut down because they didn't get any oxygen. Organ failure in Walt was severe and life-threatening. He was as close to not making it as I've seen.
I was probably the most scared in my life.
Over the past 7 years, Mary Brown's lungs have collapsed twice, and scans have revealed more than 100 mysterious cysts growing in them. Horrifyingly, no doctor can explain the frightening symptoms. Now, while on a plane to Denver for a consultation with a new specialist, she suddenly feels her lung collapse yet again.
It felt the same way the other two had felt. I felt the bubbles going up and down my back. I felt the pain in my shoulder. I felt shortness of breath. I just didn't believe it.
The minute the plane lands, she and John rush to the hospital, where pulmonologist Dr. Ron Balkasoon takes over her case.
She was admitted to hospital and had chest tubes put in to deal with this collapse of her lung.
The doctor did a complete exam. He read my chart, looked at all the records that I had.
We looked at Mary's CT scan. She had the presence of these rounded structures that look like cysts. So we had a suspicion of what this might be, but there were additional tests that we wanted to do to rule out other conditions. And so Mary had actually had biopsies done before, and we wanted to obtain that.
A few days later, the pathology department receives the tissue sample, and their report confirms Dr. Balkasun's hunch.
On the basis of our clinical findings, Mary was diagnosed with lymphangioliomyomatosis, which is also called LAM.
Lymphangioliomyomatosis, or LAM, is a rare lung condition. In a healthy individual, contraction and relaxation of smooth muscle cells in the lungs play a crucial role in delivering oxygen into the bloodstream. But in patients like Mary, for some unknown reasons, these cells are both overproduced and abnormal. As a result, not enough blood and oxygen can get to the lungs. And so, experts suspect, the healthy tissue dies and is replaced by cysts.
LAM impairs blood flow to the lung, and it has an impact on the ability to move oxygen into the lung. Both of these will likely lead to a decrease of nutrients being supplied to the lung tissue itself. There's a breakdown or necrosis of lung tissue, and the lung responds by the formation of cysts.
I was very upset to learn that I had LAM, and my reaction was, I don't want to have LAM. That's not a good one to have.
Even more unsettling, Dr. Balkasun can't tell Mary and John what triggered the onset of the disease. But the current theory suggests that LAM is genetic.
The good thing for me is that it is not an inheritable genetic defect, and that kind of gave me hope that my children won't have this.
But while the disease is most likely congenital, Mary's first symptom, her collapsed lung, was caused by one of the cysts bursting.
The bursting that occurs in the lung from these various cysts is a purely random event, and we still don't understand exactly why. These cysts will form throughout the lung, but when they form on the very edge of the lung, they can eventually pop or burst. Then when they burst, air starts to escape out of the lung, and it collects in the space between the lung and the chest wall. The chest wall is a very rigid structure, whereas the lung is really collapsible, much like a balloon. So what happens is that air that's building up will push the lung down because it really can't push out and expand the rib cage. And this is known as a pneumothorax or as a collapsed lung.
As her disease progressed, Mary's ability to breathe while exercising was increasingly limited.
Their airways become compromised by the smooth muscle infiltrating them, and as a result, they have obstruction of their airways. If Mary's condition had not been diagnosed, it would have continued to deteriorate. As these different structures become more and more obstructed by these smooth muscle cells, the person's function begins to decline. After a period of time, you can actually have a destruction of the airways. When these become infiltrated by these smooth muscle cells, they actually start to break down and form these cysts. Over time, with numerous cysts forming, there actually is a weakening of lung mechanics.
Lung tissue is being destroyed by the smooth muscle cell invasion.
Unfortunately, as it stands at the current time, there is no known cure for LAM.
That was very hard to accept, that there's nothing I can do about this. There's no medicine I can take. That's very hard.
At the current time, according to her CAT scan, she has about 40% of involvement. And so she will likely, over the ensuing 10, 15, 20 years, have a progressive decline unless we find some newer therapies that can be used. And she may ultimately need to be considered for lung transplantation.
I was told that you can't survive on less than 25%. So I know that in my future there might be a lung transplant, but I hold on to that as like the last resort. I have a last resort.
And it was of grave concern to us. It certainly changed the way we looked at life and how long we have on this earth. It was quite difficult.
When she kind of went through the prognosis with me, I was utterly shocked. I couldn't believe it.
Fortunately, some effects of the harrowing disease can be slowed down.
After the initial shock wore off After I learned more about it, then I realized that I could still have hope.
Probably about 20 to 30% of the individuals who have LAM can use bronchodilators that actually will cause relaxation of that smooth muscle to open up the airway. Exercising regularly and keeping the rest of their body fit is essential. So if a person keeps fit and they utilize oxygen more efficiently, then whatever air they are able to get into their lungs, they're going to be able to use more efficiently and participate in more activities of daily living.
As Mary struggles to grasp the gravity of her diagnosis, she can't help but wonder why Dr. Balkasoon was the only physician able to recognize the disorder.
First of all, LAM is so difficult and tricky to diagnose because it's exceedingly rare. We know that there are at least 800 individuals in the United States who have this condition. And the clinical features can certainly be seen in many other more common lung diseases such as asthma.
I think that my mom was relieved when she found out because she knew her enemy and she was going to beat this thing.
Walt Bridegan has just been diagnosed with a deadly condition called systemic capillary leak syndrome. Unfortunately, the disease is so rare, doctors aren't even sure how to treat it.
You got to figure a way to stop the leaks. All these little holes in the capillaries somehow need to be plugged up. We gave what's called albumin intravenously. Albumin is a protein that can, in some cases, get fluid out of the space outside of the blood vessels and suck it back into the blood vessels. So I said, I can't tell you for sure this is going to work, but we've got to try something.
And so I'm sitting there thinking the worst, like what would I do without him?
I think within maybe 4 to 7 hours after he started the IV, it was just a fresh, normal feeling, and it worked quite well.
That was a big relief, knowing that at least there's something out there that can help him.
But the grim reality is that the fix may only be temporary. Although the treatment appears to have closed up the existing holes in Walt's capillaries, new ones can open at any time and without warning.
We had talked with Dr. Fino, what the possible triggers are, and he said there was no recorded list of the triggers.
Unfortunately, Walt will need to be carefully monitored for the rest of his life and treated in the hospital at the first sign of a major recurrence. But despite the difficult prognosis, the 50-year-old is lucky to be alive.
Walt's systemic capillary leak syndrome, had it not been properly diagnosed, would no doubt in my mind have taken his life.
But while Walt and Nancy are forever grateful for everything Dr. Fino has done for them, they can't help but wonder why the disease wasn't diagnosed when it first surfaced 2 years earlier.
The first time Walt was admitted, he was sick with a viral cold-like illness, and so was his family. So that was the direction that I went. The second time around, this could not have been a virus because he had recurred. So I better look a little bit further and do a little more intensive investigation.
We think there's hundreds or thousands that have had it that didn't live through the first episode. Right now, we think there's less than 50 in the world.
Systemic capillary leak syndrome is the rarest disease that I have ever encountered in my 30 or so years of medicine.
Today, 4 years since his first attack, Walt has learned how to manage his condition.
With capillary leak syndrome, the leaks will continue. With mine, I leak usually once a week, but one thing that I'm blessed with is that I can tell when it's getting serious. And I go straight to the emergency room. I have a bracelet that tells them exactly what to do.
Walt is very lucky. He's one of the ones who have lived the longest with it.
There's a sense of hope. I think every time the attacks get easier.
We're still together. We just celebrated our 30th anniversary. My plan for the future is to be able to celebrate my 100th wedding anniversary with Walt.
I gave her my promise I'd stay alive. Now we're years later. We're still able to spend a lot of time together. I'm alive. And I think it's really all I need.
Today, Mary is doing amazingly well, determined to face her disease with hope and optimism.
I work out a lot. I think it helps my health. I consider my lungs, just like every moment in my life, to be like fine china. It's precious. I've learned everything I can about LAM, and I am now working with the LAM Foundation.
I'm really proud of my mom and how she's handled her diagnosis. I think a lot of people would fall victim to self-pity and just give up. But my mom fights it by going out and exercising every day, and she's not giving in. She hasn't changed. She's still a powerhouse.
I tell Mary every day that I love her so much and I'm so grateful of our life together.
Every day I wake up and I go, shoot, I have LAM, but the next thought in my head is I'm also just Mary, a teacher, a wife, a mom, and I get a lot of value in my life from being those other things.